viewers as well.
Yeah, actually, I'm also waiting for that. So before we proceed, there are a few things which I say in the starting of the podcast. Let me just say it, and then we can just move on to
Yeah,
question answers part. Okay. So this is for the Indian audience. आप लोगों को I'm just speaking in Hindi. Okay. So
yeah.
आप लोगों को अगर कोई भी एकेडमिक्स में अगर कोई भी हेल्प चाहिए तो मेरा व्हाट्सएप नंबर दिया हुआ है एंड यू कैन ऑल्सो ज्वाइन माई व्हाट्सएप ग्रुप. ओके. एंड द लिंक ऑफ द व्हाट्सएप ग्रुप इज इन माई इंस्टाग्राम प्रोफाइल. और आप लोगों को कोई भी अगर डाउट आ रहा है एकेडमिक्स में फर्स्ट ईयर से लेकर के फोर्थ ईयर तक, इसके अलावा भी अगर कोई भी डाउट आ रही है तो आप उससे पूछ सकते हैं. साथ ही साथ मेरे टेलीग्राम चैनल का लिंक भी अपलोडेड है. टेलीग्राम चैनल पे मेरे सारे के सारे बुक्स अपलोडेड है. ओके. So now, sir, we are good to go. I have said all the things. And one more thing, which is very important, that please go and follow sir on his Insta. At least he should have some followers from our side too. So that is also very important. Please go and follow him. His reels are quite knowledgeable and you'll enjoy it. Okay. So I follow him on my Instagram. You can just find his Insta ID on my follow link. Okay. So, sir, before we proceed, I want to ask you about what's like, how is everything going on in Australia where you are working? Like, how is it for you? Can you just describe it a bit?
Yeah, cool.
What you
So
do and actually,
my name's Dan. A lot of people in Australia, they call me Uncle Dan because I think this
yeah.
that people can find a bit of comfort in calling me uncle, I think. So yeah, Dan, nice to see you. Nice to meet you, Ash. I think it's so cool that the internet can join us, no matter if one person's from Australia and you're in India. I think it's so cool that we get to just have a conversation and try to help and educate as many people as we can. So I recently started my own physio clinic about 9 months ago. So it's been a really good and interesting journey from the last 9 months. I've learned a lot about myself, about business, about physiotherapy, and just about building relationships with people. So, yeah, my own clinic, and my clinic has some treatment rooms to the side, and then in the middle is a gym where you can do your rehab and all your programs and stuff. So, uh, currently, I'm seeing mostly, I would say, mostly general population people, but I would like to niche towards more higher level sports athletes and especially ACL rehab. We know that with ACL rehab, a lot of people don't. A lot of people think that it's just doing a few squats and then after 9 months or 12 months you can go back to sport. But actually, there's a lot more involved, and a lot of people aren't. They are not doing what they should be doing to ensure that when they return to sport, they have the best outcome possible and reduce the risk of re-injury as much as possible. And outside of physiotherapy, so as I was talking with Ash off air before, I was born in Taiwan. So I love Taiwanese food. So me and my wife, we like to eat a lot of different cuisines. So Korean food, Indian food, Vietnamese. We love all sorts of food. So that's outside of physiotherapy. We are big foodies. So if I come to India, Ash, you can definitely cook us some good.
Yeah. Yeah. Actually, I'll definitely cook for you. I'm a nice cook. I'm a good cook. I'll cook
Oh,
food for you.
I like confidence because it makes me feel very confident in you. So that's good.
Okay, so sir, actually, what happens here is that I have few questions which I've already prepared. Okay, and people here who are watching this live session can also ask questions, and which will be shown in the like inferior side of the phone. I don't know why I'm just using these terminologies, but again. Okay, so the first question which I want to ask, sir, that as you are particularly working for ACL rehab only, so I just wanted to know what kind of sports which are generally, which causes the ACL injury, which
Yeah.
like more often causes ACL injury. Is it the non-contact sport or is it the contact sport? And if you could give us the name also, then it would be like beneficial.
Then it will be even better, of course.
Yeah.
So with ACL injuries, most of them do occur with contact sports. So in Australia, there are three contact sports that I can think of that really comes to mind. The first one is, have you heard of AFL before? AFL. So it stands for Australian Football League,
Okay,
and
I've heard of it.
yeah, you've heard of it. So in especially where I live in Melbourne, it is massive. It's like a religion. Everyone
Okay.
loves it, follows it. Very, very strong. So AFL is a combination of lots and lots of running and lots of tackling and lots of
Okay. So
and
your voice is actually breaking in the between. Whenever you say now, there are a few words which just
oh, okay.
gets
Sorry.
disappeared when you speak. Okay.
Sorry.
Yeah.
My internet connection is actually pretty good, so I don't know what else I can do.
Maybe you could just place your mic in a better way,
But my mic is on my phone. So
Okay. Okay, you can just go on.
okay. Is that
You
all
can
right?
go
Is
on.
that all right?
Yeah. Yeah. Say.
Okay. So I think the sports that make the most create the most ACL injuries would be those contact sports.
Okay.
Another sport that comes to mind would be rugby. So as we all know, rugby is very very contact heavy, and lots of big humans, big girls, big boys, they just start to smack into each other. So a lot of the times when you have another human hit into you, there's just so many variables that you can't control. um, I actually did some research. There's an Indian sport called kabaddi.
Yeah. Kabaddi.
Kabaddi? Do you
Kabaddi.
know
Yeah.
ACL
Yeah.
injury?
I've played it.
Oh,
No, I didn't know that ACL injury is common in Kabaddi, but yeah, I have played Kabaddi.
yeah, yeah. So I was watching some videos on it, and it seems like
Okay.
a lot of contact. So I just think that
Okay.
when there's a lot of contact, there's a lot of variability, things that you can't control, and so that
Okay.
I would say increases the risk of ACL injuries.
Okay. So yeah, actually, I watched the rugby sports on Friends series for the first time, and then I heard
Oh,
of it. And then when I was reading Kareem Khan, which is like a book of PT sports, that's
mm,
when I got to know that rugby actually can cause ACL injury, and I was like, wow, I know that.
yeah.
I have watched that sport.
And on that note too, I'd just like to also add that the sports, not just contact, but also the sports that have a lot of pivoting, twisting action, changes of direction. For example, like soccer, although soccer is not meant to be contact, but we know that with soccer and basketball and netball, there's all not meant to be contact, right? There's not meant to be any tackling, but we know that there are high levels of ACL injuries in those sports too. And I think
Okay.
it's partly because it's so many twisting actions and very rapid changes of direction.
Okay. So, sir, next question is why ACL injury is the most common injury of the knee joint? Is it because of some kind of anatomical reason or physiological or any kind of other reason?
That's a really good question because I think the reason why the ACL is the main ligament inside the knee that is the passive
Mhm.
that stops the tibia, the shin bone, from translating forward. So this shin bone here, thigh bone is here. The ACL is in the middle, and it stops the shin bone from coming forward. So I think when you are in a situation as the athlete, and you go for a direction change, or someone comes and tackles you, and your muscles aren't quite quick enough to react to the situation, then all the load goes onto the passive structures of our joint. So inside the knee, the main one of the main passive structures, as we know, is the ACL. You've got your MCL, your LCL, you've got your meniscuses. They all act as a really big stability. They all play a huge role in the stability of the joint. And the ACL, I think the reason why it's the most common injury, I don't know the exact answer, but we know that it is the most common. Is 40% of knee injuries are ACL related. So that's probably a question we can ask God.
So, actually, I was reading Karim Khan. In that book, I just got to know that ACL injuries are more common in females rather in male.
Mhm.
And the ratio is 1:3, if I'm not wrong. So, it's thrice the number.
Yeah,
So,
that's
that
correct.
is,
They say
and the reason,
Yeah, they
please say.
say with the females, they have a different anatomical look, and the angles are very different compared to men.
Mhm.
So, for example, the Q angle of the hip and knee is much more increased in females, and females are
Mhm.
more they generally speaking have laxer ligaments and laxer joints. So that could be another could play another role to increase the risk of ACL. And also they say that females' knees naturally cave into more valgus. And with ACL injuries, one of the mechanism is a valgus force and a rotational, an internal rotation with a valgus force. So those could all add up to the reason why females unfortunately experience more ACL injuries compared to men.
Okay. So, sir, third question is actually I want to know personally
Yeah.
on my personal views, like what is your views on special test? Let me just complete the question for you. What is
Mhm.
your views on special test related to ACL injury? Do I need to perform the special test if the MRI shows there is an ACL injury, or even if the MRI don't show the ACL injury? Do I really need to perform the special test to get ensure that this guy or this girl has a ACL injury? What is your views on that?
Mm. Well, I think special tests are important to do because you don't always have access to an MRI machine right there, especially if you're more living more rurally where there's no access to MRIs, then really you can only rely on your special tests to give you the most
Okay.
up to date provisional diagnosis of what could be the main structures that are injured. I think if the special tests that you do, for example, for those of you who don't know what the special tests are for the ACL, there's three main ones. There's the Lockman's test, and there's the anterior draw test, and there's also a pivot, which I don't do personally. I don't do the pivot yet, but I do the Lockman and I do anterior jaw tests quite a lot. So if your special tests all come back positive, the research actually says that that is equivalent of doing an MRI. It's like the gold standard for an ACL injury. However, I would still refer them to get an MRI scan because there are some other structures in the knee, for example, meniscuses, that the special test for meniscus, is not that great. And if you have an acutely injured knee, most of the meniscus tests that you do will flare up the knee. So all your tests will come back positive. And does that mean that they have a meniscus injury as well? Maybe or maybe not. So the reason why I would also refer for MRI is just to assess if there's any other injuries. For example, if you have a huge bucket handle tear of the meniscus, you want to know that early because, as we'll talk about later, in terms of whether you want to go down surgical or non-surgical, you need to know what other structures are also injured. So you need to know that sooner rather than later.
So basically, MRI is required, and you need to perform a special test. And uh, before or after, you need to have an MRI scan. You should actually you
Yeah,
don't need you should just refer the patient for an MRI scan. Okay.
yeah. And I would also
So the first.
just also add um, with I'm just reading the comment. Why are
I
you looking?
just block him.
Is he talking about you or me?
I would never mind that. I personally don't even care about the comments anymore. Yeah.
That's okay. That distracted me. I was also gonna say, um, what was I gonna say? Oh, with
Yeah.
the special test of the knee, it is super important that you practice as much as you can because if you have an acutely injured knee and you are not very confident with the way that you do your tests, then you're going to make the patient very anxious and they are going to they're going to tense their muscles. And if we know that if you're doing the Lockman's draw and their hamstrings are very like they're activated and they're switched on, then the test will be negative because the hamstring
Okay.
it on, it stops the shin bone from sliding forward. So when you do the test,
Okay.
you actually need the knee and the muscles around it to be as relaxed as possible. So that comes with practice. And you also want to make sure you test the other side so that you understand what baseline feels like.
Yeah,
Yeah.
actually, you should always go for normal versus abnormal because with each body, normal means the different. thing.
Yeah.
So yeah. So the next question is actually related to this question only. Do all ACL injury requires surgery?
No.
Okay. So then my follow-up question would be like, how to prevent ACL injury?
Yeah. And sorry, I shouldn't have given you such a closed answer. I'll expand. I'll
It's
expand
fine.
I'll expand a little bit on my answer of no. The reason why I say no, not all ACL injuries need surgery, is because we actually know that there are some ACL injuries that can do quite well without surgery and can actually
Mhm.
return back to sport without it.
Okay.
So this is a very very big question, and it will take a lot more than 5 minutes to explain everything. But the main ideas that I wanted to put that I wanted to discuss is not every ACL injury requires surgery, and there is a new emerging treatment called the cross bracing protocol. I don't know if you've ever heard of this before,
I've
Ash.
never heard of that.
Okay, cool, cool. So it's called the cross bracing protocol, and it's for a very specific type of ACL injury. So from my memory, it's the ACL needs to be can be completely ruptured, but it needs to be ruptured at a specific area of the length of the ACL, and also there cannot be any other MCL. Oh, there can be some MCL injury, but there cannot be any massive meniscus injury. So basically, put it a very to put it really roughly, it needs to be a very clean ACL injury. So if you get something like this, you can actually take them through this cross bracing protocol where you lock their knee at 90 degrees. It's quite a invasive technique because their knee needs to be at 90 degrees for like the first 2 weeks, and then slowly as the weeks go by, you can start to increase range of motion. And at the moment, people who have done the cross bracing protocol, there is about at the end of it, if everything goes well, there is about a 90% chance that the ACL will regrow and reattach. So
Okay.
that's huge. That's massive because these people have not underwent any surgery at all. But the thing with this cross bracing protocol is that not everyone is a suitable candidate for it because, as I said, your knee needs to be at 90 degrees, locked at 90 degrees 24/7 for like the first 2 to 3 weeks. So if your job
Mhm.
requires you to do a lot of walking, and also if you have a huge bucket handle tear of your meniscus, then you wouldn't be a suitable candidate to undergo this protocol. And I actually have a friend who lives in Sydney, and recently tore his ACL. He's a physio, and he went through the cross bracing protocol, and he's just recently had a repeat MRI, and his ACL is now regrown and reattached.
Okay.
Yes,
Okay. Okay.
it can happen, and there's actually quite a high chance that it can happen. The only thing is that not everyone is a suitable candidate. And on just to expand also on why not all ACL injuries need a surgery, it all comes down to the goals of the patient. So if the patient that you have in front of you, if their goal is that they want to return back to high level, um, lot of pivoting, twisting, direction changes, sport like soccer or basketball or rugby, um, then currently the research is showing that it's actually probably a better idea to at least get a surgical opinion rather than to go no surgery. Because
Okay.
although we know that even without surgery, the person might be able to do well, but they will only do well until they don't do well, if that makes sense.
Okay. Okay. So there are just two questions
Yep.
following this question. The first one is, what is this? Is there any evidence of this? What you're saying, cross knee bracing?
Yep. Cross
Uh,
protocol.
so there is evidence, right?
Yeah. It's
Okay.
quite a new protocol, and I think it's
Okay.
most emerging out of Australia. But there
Okay.
are people that have undergone this protocol and have good results. So I think in the
Okay.
next years it will be even more robust
Okay.
evidence.
Okay. The second thing is, like, in what case? ACL injury requires surgery? Like, how would you know that now it requires a surgery? It can't go for management, for
Yep.
physiotherapy management. How would we know about that?
So the only time that I would say yes, this ACL injury needs a surgery as soon as possible. First of all, I would never suggest someone go for surgery as soon as possible. I would always suggest that they wait at least 3 months if possible. But we see online and on TV when a sports player, top level sports player, when they have an ACL injury, the next day they're posting a selfie of them already on the surgical table and have surgery. So um, I would always urge them to wait for at least 3 months. The reason why I urge them to wait is so that their knee can actually settle down. So we want to have what we
Okay.
call a quiet knee. So a knee that is not quiet is a very swollen knee and a knee where there's a lot of pain. So if we can get their knee to become quiet, which means no swelling, full range of motion, can walk normally, and can regain some quadricep and hamstring strength, then that's what we call a quiet knee. Their post-operative outcomes is actually a lot better than someone who goes in for surgery as soon as the injury has happened.
Okay. Okay. So this is just a long answer which is just given.
Yeah.
Can you just sum it up in just two, three lines? Like, how you just already said that no, not all ACL injury requires surgery, but
Yep.
can you just sum it up? After this question, like how would you prevent an ACL injury? Let's say that I had an ACL injury. I am a player and
Mhm.
I really don't want to get an ACL injury in my knee. So how would I prevent it? And also give us some insights about the home program.
Mm. So your first question was how do I prevent an ACL injury?
Yeah.
Oh,
Yeah.
so is this for someone who has already done their ACL before, or has someone who has not done their ACL before?
Okay. Tell me about both of them. Just tell talk. Ah, my English. So just give us the insights on both of the part, like
Sure.
about both of them. Okay.
So for someone who has already had a previous ACL injury,
Okay.
best way to reduce, I don't like to use the word preventing
Okay.
injury. I find that when you say the word preventing injury, it gives them the idea that they can do a couple of things and their injury
Okay.
will not. So I like, instead of saying prevent, I actually like to say the words reduce the risk of injury. So it's
Okay.
a bit more of a mouthful, but I think it gives the patient a better overall understanding. So short answer is to make sure you train your legs, make sure you don't skip leg day at the gym, and uh, you want to also focus on maintaining your quad strength. So quads
Okay.
are king, and that's why one of the exercises, the leg extension exercise, is one of the most important exercises when it comes to ACL rehab. So for someone who has done their ACL, in order to reduce the risk of another injury, would be to make sure you keep your legs strong and make sure you maintain, continue to expose yourself to as much training as possible for whatever sport it is, so that you condition your body to the sport specific tasks like
Okay.
changes of direction, sprinting, running, jumping, and make sure you do your gym work at least twice a week in the gym, working on your squats, your lunges, your glute bridges, etc., etc. For
Okay.
someone who hasn't done their ACL and they just want to not injure the ACL, exact same thing applies. Make sure you condition your body so that your body is conditioned to the demands of the sport, and also make sure you are in the gym working on your legs, your knees, and make sure that your leg muscles are kept strong and healthy.
So answer was the same for both of them.
Mm-hmm. Correct.
Okay. Got it. Got it. Uh, can you talk about the home program?
Yeah, yeah, definitely. So the home the home program, it all comes down to the individual or the patient.
Okay.
So short answer is that it depends, as most things goes, it really does depend. But the patient's home program will be dependent on their goals. For example, if they are a middle-aged mum and they did their ACL because they stepped off a curb awkwardly, and then your home program might be less jumping, less sprinting. It might be more about getting them back into some level of squats, some lunges, maybe some step ups, some step downs, and if their goal is not to go back to high level sports, then really there's no real point getting them to do very, very difficult, drop jump and hop testing. There's just no point. So whatever your homework is for the person, your program needs to always relate back to their goal. So conversely, on the other hand of the spectrum, if they are a high level athlete, then you've got to make sure that you give them exercises that are appropriate for the demands of their sport. So if they're a high level rugby player and you're just getting them to do 3 sets of 10 of bodyweight squats and that's it, then that's not going to match the demands of their sport.
Okay. So it's totally subjective, first of all. Am I right? Okay.
Correct.
So it's totally subjective. And the thing is, it totally depends on your goal and demands, right?
Yes. Yeah.
Got it. Do you use any modalities, sir, in your clinic for ACL rehab?
When you say modalities, do you mean things like ultrasound, TENS machine, that thing? Yeah. Personally, when it comes down to the more generic modalities like TENS machine, ultrasound, I don't use them, but I wouldn't tell them not to use it because I think that these modalities can be quite helpful if they're doing all the other stuff really well. For example, if we look at baking a cake, because you like cooking, or making like a delicious noodle dish. If you're making noodles and you ignore the noodles and you just put the flavoring and the other stuff, but you totally ignore the noodles, then the final dish it will be kind of weird, right? It wouldn't be very nice. So I'm just going to use baking a cake analogy. So if you only focus on the icing, the chocolate sprinkles, the things that make the cake taste nicer, those are the things that are like your TENS machine, your cold bath, your saunas, your all the other stuff. That's what you're focusing on. And I think that you're wasting your time if you only focus on that. You should be focusing more on having good quality sleep, having good nutrition, drinking enough water, managing your stress. Those are the things that actually make the actual cake. Everything on top, that's like all the other stuff. So modality, in terms of talking about modalities, if they want to do some TENS machines just to get some more muscle activation while they watch TV, that's fine. There's other ones that you may have seen, like blood flow restriction. Have you seen that before?
Blood flow restriction. The cupping thing?
No, that's not cupping. Yeah, cupping is another modality that can be used as well. But blood flow restriction is when you put it's like when you're about to take blood, and the nurse, they put something tight around your arm to make your blood vessels pop out. You know that?
Okay. Yeah. Actually, I know that.
Yeah. So what you can do is you can put one around your upper thigh, and you can do things like your leg extensions. And the whole point of doing blood flow restriction training is so that you can lift less weights, but have the effect of you lifting heavier weights. So I think there's some evidence to support it. But again, I think that is all modalities that can be used, but shouldn't replace the good old-fashioned strength and conditioning. One modality that I have recently started using in my clinic are force plates. So there's 2 plates that you put on the ground, and you get the patient to step on it, and it measures exactly how much force is being produced by each limb. And you can do things like jump test, hop test, squats, and it can measure exactly which leg you're favoring more. So it can be used as a good outcome measure and like a good objective measure so that the patient can get more buy-in so that they will do their homework.
Okay. So So actually, I would request you to make more such reels on these types of content, and please, if it is possible, then collaborate with me. I personally like. I would actually request and advise you to make a reel talking about the week-wise protocol in the ACL rehab, and also about the modalities that you use on a regular basis, or
Yeah.
you know. So it would be much more beneficial for people like us, those who are really interested in sports physiotherapy. So this
Yeah.
is just a request, just you should please keep in your mind, Yeah. So my next question is, sir, that how to do counseling of an ACL patient. Sometimes what happens is patient they just think that yeah, I'm good, and I can just continue playing sports just like normal days. They don't agree that they are having ACL injury. They won't listen to you. So
Mm.
how would you counsel these types of patients? So can you just describe it a bit?
Okay, that's a really interesting question. I would say the number one thing is to have really good rapport with your patient and allow them to understand that us as the physio, us as their physio, we have their best interest in our hearts, and we're not seeing them for any other ulterior motive. So I think number one is having that good rapport with the patient is super important. Number two is if they are insisting on playing and they feel like they are able to play even though they have an ACL injury. Well, maybe they don't have an ACL. Maybe that's something you have to dig a little bit deeper, because if they are insisting on playing, well, then maybe they are very eager to play, and yeah, perhaps maybe you need to check your diagnosis again. The other option is if it's already confirmed that they have an ACL injury and they still want to play because they're a little bit crazy, you need to then, as their physio, you need to then be quite blunt and give them the options. So you just say to them, look, if you go and play this match on this weekend, here are the things that might happen, and you need to just be very straight up with them, because someone like this, they sometimes need to be hit with, not literally hit, but mentally hit with the facts. So if you play this weekend, there is a high chance that you might have an instability moment. And even though right now it's only your ACL that's injured, if you have an instability moment, you might then go on to damage your meniscus. And if you damage your meniscus, then that will make the surgeon's job a lot harder and also make your rehab a lot harder. If the patient is willing to put up with the risk, that's fine. They are an adult and they can make a decision for themselves. At the end of the day, our job is to inform them of all the possible outcomes, and their job is to understand and listen to us. And then at the end of the day, they are adults and they can make their own decisions as well.
So so if I'll just summarize everything,
Yeah.
you just need to educate them
Yes.
for what's going to happen if they continue playing.
Yeah.
Okay. And what ACL injury is and how it can affect your ADL, like activity of daily living. You just need to educate them and make them aware of what has happened to their knee. So
Yeah.
this is what you have said.
Yeah.
Okay,
100%.
got it.
Education as a physiotherapist, I think, is one of the most underrated
Mhm.
tools. A lot of people, a lot of physios, especially young physios, they just want to get straight to the treatment because they feel like the patient's paying, so I need to massage them a little bit more. But actually, education and sitting and talking with them is one of the most underrated treatment tools as a physio.
Okay, got it. So, sir, I want to talk about the next question is actually about the unhappy triad. So, I just want to know about the rehab protocol for unhappy triad, and also what will be the rehab protocol if there is associated injury. Let's say that with ACL injury, patient have meniscus, LCL, and MCL injury.
Yeah,
So, what would be the rehab protocol, and how will it differ from the patient who actually just has an ACL injury? Please
right.
talk about this.
So, if a patient has a meniscus injury, it might just make their symptoms linger for a little bit longer. And depending on the severity and the location of the meniscus tear, it might affect their symptoms. So, for
Okay.
example, if they have a really big bucket handle tear, well, then technically that should be surgical opinion, because depending on the location of the meniscus tear will affect the healing. So there's 3 different zones of the meniscus. Depending on which zone the injury occurs in will directly affect the likelihood of it healing. So I think, according to memory, the outer surface or the outer zone is the more has more blood flow, and then there's a middle zone which is kind of good blood flow, and then you've got the inner zone which is zero blood flow. So if you have a tear in the middle, in the inner zone, the likelihood of a healing is very, very low. There can be some meniscus tears and giving the person no symptoms. So it's all dependent on how it occurred and the severity and also the location of tear. So if the patient has a massive bucket handle tear of the meniscus, it can give them quite a lot of locking and catching symptoms. And so that is not a good idea to start loading them up too early. So there is a saying that I like to tell my patients, which is, with any injury in that you may have now or in the future, just follow the simple rule: settle it down and then build it up. So settle it down and then build it up. Whatever injury it is, calm down the symptoms, reduce the swelling, reduce the pain first. And then after you achieve that, all right, now let's get the muscles going and let's start rebuilding you back to your previous strength. Yeah.
Okay. So can we talk a bit more about the rehab protocol? What would be your goal? So let's talk about that.
Sure.
In
So
such cases.
the rehab protocol, there's many different protocols out there. The one that I personally use, it's called the Melbourne ACL Guide 2.0, and it's divided by. You can all search this up on Google. It's for free, by the way, which is awesome. So there's 2 guys. Their name is Mick Hughes and Randall Cooper, and these 2 guys in Australia, amongst the ACL world, they're very popular. Because they're very smart and they know a lot of stuff about ACLs. So these 2 have teamed up and they've written this ACL rehab guideline, and it's all a criteria-driven based guideline. So it's not quite a protocol. Protocol is a little bit too formal, whereas this Melbourne ACL guide is more of a criteria base. So I think it's divided into 4 stages. To get from stage 1 to 2, you need to almost earn the right to move on to stage 2, and then to stage 3, there's a checklist. So if you can't do them, if you can't check them off, then you can't move on to the next stage.
Okay.
Yeah. So search on Google, Melbourne ACL guide. It's really, really helpful.
So your voice your voice broke again. Can you just repeat the name? Melbourne?
Yeah. Melbourne ACL Guide 2.0. Really helpful.
Okay, Melbourne ACL Guide 2.0. Okay. So the next question would be like, what is the return to sports criteria for athletic people and also for the normal people?
Yeah. So return to sport in terms of an ACL injury, say this person had the surgery, you'd be looking at least a 6 to 9 months before they can return to sport. Now, returning to sport is different to. Sorry, I should say, in my idea, returning to sport equals returning to training as well. So not unrestricted match play. I would say returning to training also counts as returning to sport. So return to training can be as early as 6 to 9 months. Returning to sport, you don't want to introduce that under 12 months for someone like a general population or even like a recreational athlete. If your job is to play the sport and you are earning your income based on that sport, and you wake up and you're able to do your rehab, then you could go back to your unrestricted match, as early as 8 to 9 months. But that's very, 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 very early. So in terms of returning to training, you've got to obviously make sure that in the physio rooms, you've already been exposed to some hopping, some jumping, obviously gone back to some level of running. So some returning to running can be as early as 3 months post-op. but usually the later you leave it, maybe to that 4 to 5 month mark, the better. There's a couple of criteria in terms of returning to running that we can also talk about if you like, but returning to training, the longer you spend in training, the better outcome you'll have when you return to unrestricted match play. So the research is showing that if you spend at least 4 weeks of solid training, unrestricted training, then that's a good indication that you can go back to sport, unrestricted match play. And there's also a lot of psychological tests and questionnaires you can get them to do as well. So just to name two off the top of my head, one of them is called the IKDC questionnaire,
Okay.
and the other one is called the ACL RSI, which stands for ACL Return to Sport After Injury questionnaire. It's a short questionnaire, and it adds to the battery of tests that will put the patient in the most favorable outcome when they do decide to return back to sport. Other tests that you can do is limb symmetry, so looking at quad strength left and right and making sure that it's 90 to 95% symmetrical. And hamstrings as well. There's many different hop tests, jumping tests that you can do. So yeah, there's quite a lot of tests that you can do to ensure that when they do return to training, they'll have the best outcome.
Okay, so what you're saying is there are tests, there are questionnaires, and there is one more thing, which is when you see that the patient is able to perform his daily to daily life like normally. So that means that yeah, now he can return to like back to his normal life. And for sports, when he is able to take the load on his knee, so that is how you get insured, and along with that, tests and questionnaires and everything,
Yeah.
right? Okay, got it. Got it. Got it. So the next question is the rehab protocol same for the athletic person and the normal person? What is the similarity and dissimilarity in both of these cases?
Yep, that's a good question. I would say the initial phase is basically identical. The initial phase, as we talked about, is just trying to settle everything down. So trying to gain some control of the swelling, reduce it as much as we can, because a swollen knee is not a very happy knee.
Okay.
The difference, some other things that you want to focus on early on is reduce swelling, normalize your gait, and also we want to try and get the quadriceps and the hamstring muscles to co-contract so that it can help to clear the swelling. Where it becomes different is more towards the mid and late stage rehab. For the general population who any sporting goals, their rehab will probably stop progressing after the mid stage. So after getting them back to squats and lunges, and other exercises, they probably would never go back to harsh changes of direction just because there's no real need. So where it comes down to where it becomes different is around that mid to late stage, and it depends on the goals of the patient. And one thing to bear in mind too is that goals can change. If this person is a high level athlete and their initial goal when they first come to see you is, I want to get back to whatever sport it is, just keep checking with them. Maybe every 2 or 3 months, just check in with them and say, hey, 2 to 3 months ago, you told me your goal is to do this. Is that still the case? Because the reason why I say, because recently I was helping rehab a 18-year-old female from a ACL injury, and she initially her goal was to go back to high level sports, but now after
Yes, sir.
rehab a while, she actually doesn't want to. It's not the top priority for her anymore. She now wants to run a half marathon, so her training is going to be less change of direction, jumping, sprinting. It's now going to be more about longer distance running. So check in with your patients regularly because goals can change.
Okay. So ultimately, it just all narrows down to your goal, right? So what is
Correct.
the goal of the patient? And if it changes according to the time, then you must change your rehab intervention according to that.
Yeah,
Okay.
yeah. And
So
I
that's
would also like to add, when someone comes in to see you for an ACL injury and they might previously not have been going to the gym or not very physically active, this is actually the perfect time to educate them that going to the gym, lifting weights is not just about building big muscles and looking good naked. It's now about let's get you in the gym so that we can maintain and build muscle and build bone density so that we can promote general health and well-being, because we know that the World Health Organization, they recommend everyone, no matter what age, what gender, to do 2 strength training sessions a week. And I would say right now in Australia anyway, not many people are doing 2 strength training sessions a week. So this is a really good opportunity to help educate them that this is what you need to do. So let's use this as a blessing in disguise, and let's just get you more overall, more physically active and more healthier.
Okay. Okay, got it. So my next question is actually very related to this part only. How to set goals and decide rehab protocol for for normal patient and athletic people again? How
Yep,
would you set goal for them?
yep. So ask the patient.
So okay, I didn't know that it would be like a very easy answer. So
Yeah,
okay, and how would you decide rehab protocol? So according to that, right?
yeah. Ask the patient what their goals are, what they want to achieve.
Okay.
You want to ask them, is there any goals in the next month? And so your short term goals, and then what are goals you have for the long term? And so you always want to write them down so that we can always come back and visit it. Yeah.
Okay. So then I actually am very curious that physiotherapy it not just it's about intervention or exercise thing. It is also very communicative kind of stuff. You need to actually communicate with the patient.
Yes.
So that is actually very interesting to know about that. So is there any recent advancement in PT intervention, evidence based, obviously,
Yeah. So I would say one of the first the emerging ones would be the cross bracing protocol, the one that I was
which I've
talking.
already said.
Yeah,
Yeah.
earlier. That's probably one of the biggest ones. And also in the recent years, there's been some really high level evidence, uh, randomized control trials, showing that ACLs can heal even without the cross bracing protocol. So there's, I think, 30-50% of ACL tears will spontaneously heal in 3 months.
Okay.
But the thing is that a lot of people go to surgery before that 3 month period is up. So they should. So that's one other thing. And yeah, that's about the 2 main ones that I can think of.
Okay, no issues. And the next question, I was talking about this thing only when I said now that please make reels on these types of topics. So this is what
Mm,
I was talking about. How to prepare week-wise protocol and decide frequency, intensity with each patient. Every patient is different. So how
yeah,
would you decide the frequency of the exercise and intensity of the strength training, and how would you decide the week-wise protocol? How would you, yeah,
yeah.
these kind of things.
This is honestly where physiotherapy is so fun, is because every patient's different. Your approach can also be a little bit different according to their goals. I would say,
Mhm.
general blanket statement, everyone should be doing their knee specific rehab at least twice a week. And wouldn't do them back to back. I wouldn't do Monday. I would have a few days in between to allow their muscles and to regenerate and their body to regenerate, and then they can do the exercises again after maybe 2 or 3 days off. Initially, in the acute phase, you want to be working at it every day, because the exercises that you're going to give them initially, they're very low load. They're not very high load.
Okay.
That's why you can do them a lot every day. And initially, it's all about trying to settle swelling and settle the pain. So the more you do, the more you can convince the brain and the body that it's okay to bend, it's okay to extend, it's okay to contract your quad. So you want to be doing a lot. As the rehab progresses and the weights start getting a bit heavier, that's when you don't want to do it every day, because it's like you won't train your biceps every day. So why do we expect our patients to do their homework every day? Correct?
Right.
Yeah. And yeah, just to answer your question as well, in terms of the intensity. dosage, it comes down to what stage and what you're trying to achieve out of the rehab. So, for example, if you're trying to gain a little bit more muscle strength, then you want to be working lower reps but higher weight. If you want to
Okay.
achieve muscle size, more hypertrophy, then you want to be doing more volume. So maybe 4 sets of 12 to 15 reps and like a medium
Okay.
weight. Yeah.
Okay, got it. So it again narrows down to like your aim.
Yeah.
So okay.
Oh, there's also another
Uh,
one, power development, which is often forgotten, and plyometrics. So things like jumping exercises and how quickly can you move this weight? So how much power can you produce? So this is honestly, I think this is where freshly graduated physiotherapists, this is where we potentially lack in our knowledge. And it's not to say that uni sucks and uni doesn't prepare us. It's because uni, there's no way uni can prepare us for everything. So my best advice to some new grads and students even is to just spend a bit of time working in the gym and understand what it's like to do a squat, to do a deadlift, and feel what it feels like. Because that's the best way to learn, is to actually go through it yourself.
okay. So, sir, we have already answered it, like how to prepare week-wise protocol. Can you just sum it up so that normal viewers can understand it? Uh,
Yep.
for this week-wise protocol, how would, like, if someone who is new to this, okay, so what advice you would like to give them? How would you, like, it's all up to you. What would be your advice to them?
In terms of how to do the knee rehab.
Yeah, and week-wise protocol, like how to decide the week-wise protocol. Like in the first week, I'll do this. In the second week, I'll do this. In the third week, I'll do that. So,
Oh,
what are that? Huh.
okay, gotcha. Um, so if we look at the Melbourne ACL guide, it's split into 4 sections. Let me see. It's split into 5 phases. So the first, sorry, 6 phases. 6 phases. The first phase is what we call the preoperative phase. So that's
Okay.
where you try and get that knee that you've injured, get it ready for surgery. As we talked about, waiting, if you can, wait a couple of weeks, maybe 3 months if possible, to get that knee to settle down. And then moves into the first phase, which is the recovery from surgery. So that's all about settling down swelling, settling down the pain. So in terms of weeks, it's really difficult to say, because it's hard to say that the person will progress week to week. So I like to break it down more into phases, and when they have ticked the criteria, then they can move on to the next phase. And then once they tick the criteria, next phase. So moving on from phase one, which is recovery from injury, then moving on to phase two, which is starting to gain some strength and neuromuscular control. And then moving on to phase three, which is returning back to running, some agility, and then working on landings as well. And then phase four, which is then returning to sport. And then phase five, which is then all about injury prevention or reducing the risk of re-injury. So that's where you would adopt some exercise plans to help keep your knee happy and strong.
Okay. Got it. Sir, this is the second last question, and it's just yes or no question.
Yep.
Let's say that in the second week of ACL rehab, can we perform the protocol which we have decided on the first week if there is no improvement seen on the second week?
Say that again.
So let's say that you have made week-wise protocol on a patient, right? So in the second week of ACL rehabilitation, can we perform the protocol of the first week, the first week, if there is no improvement seen?
Yes.
So we can do that, right?
Yes. So
Okay.
what I'm getting from your question is, if they can't perform week one's exercises, can
Yeah.
and they are about to move to week two, can they go
Yeah.
back to week one and
Yeah. Yeah. Yeah.
yes, they should.
Exactly. So they can do that, right?
Yes.
Okay. So, and there is the last question. Do you use any manual therapies in ACL rehab?
Very less, not much. If they
Okay.
specifically ask me, hey Dan, my hamstrings are feeling really tight, then I will do some light massage, but I don't spend too much time unless they are happy to pay me to massage them. Then I
Okay.
massage no problem. But I would always spend most of my time with my ACL patients in my gym facility to strengthen.
Okay. So this is it. This is all the questions that I have prepared for you.
Awesome.
Like everything is just finished, and can we talk a bit more about how to build rapport with the patient? And this is the second part of this live session. Can you just give us few insights on that, and then we can just end the live session?
Yeah, definitely. So building rapport with patients is something I'm very passionate about because I feel like as physios, we have so much, we're like superheroes in a way because we often have the luxury to spend more time with our patients. So naturally, after you spend a long time with someone or many sessions with someone, naturally you build that rapport, you build that relationship. And there is a study that better your rapport is with the patient, the better outcome they have. Meaning, short to sum it up in a nutshell, if the patient likes you, they tend to get better. Well, how cool is that? And if the patient doesn't like you, then they tend to not get better. So actually,
Exactly.
our ability to make them like us is actually really important. So
Okay.
yeah, that's the reason why I think building rapport is so important. And also, if you don't have good rapport with your patients, it makes your workday very miserable. And if you have a really good relationship with your patient, you feel excited to see them. If Ash, you're my patient, and we are really good friends, then every time you come into my clinic, I feel excited. I'll be like, Ash, welcome, brother. Let's do some squats. Let's do some
Yeah.
shoulder. But conversely, if I don't really like you, Ash, or you're being a bit of a not a pleasant person to deal with, then every time you come and see me, I might feel really anxious or I feel very nervous, and it just makes work very not nice, not a very nice
Yeah.
environment.
Okay.
Yeah,
So actually building rapport is very, very important with the patient along with your PT interventions and exercise protocol and everything. So
yeah.
this just sum it up. I hope you enjoyed this live session, sir. And thank you so much for actually making me aware of these things in the ACL rehab. And thank you so much for sharing your knowledge. And if you have anything to say, namaste. Okay, and if you actually, I forgot this one thing. Uh, in the last, I actually have one question, and which I ask from all those guests which I invite on my live session. And this
Yep.
question is that what would be your advice to young juniors or young physios? So,
A big question. That's a big question.
yeah,
My advice, yeah, I've got one advice. My advice
yeah,
is get as much hands-on experience as you can, because if you're very confident with your hands and you, for example, you're doing Lockman's draw and you just feel very confident because you've put in the work and practiced on many different humans, fat humans, skinny humans, old, young, then it makes you seem a lot more confident as a physio. And I know that as a new grad physio, confidence is one of those things that you don't really have it. You feel like you are imposter or you feel out of your depth. So I think having as much practice as you can gives you that confidence. Even though it's your first day on the job, you are confident when you put your hands on the patient. And physiotherapy is quite a hands-on. Even though if you don't do a lot of manual therapy, you still have to touch them to assess, palpate, do special tests. That's number one advice: is to practice as much hands-on techniques as you can. Number two, practice your communication and slow down. A lot of new grads, when they first come out, they just want to ask the patient a million questions. But just know that we have two ears and one mouth. So talk less and listen more. And
yeah.
the patient will tell you exactly what you need to know. That's it.
Okay, so this just sum it up, sir. Time to quit this live session. Had an amazing chat with you, and thank you so much for accepting my offer and coming here. One more thing, sir. I'm just really looking forward to work with you, like for another live session or another webinar or any sort of things which you are interested in.
Sure.
So, yeah. So this is it. Shall we
All right.
just, yeah.
Thanks
Okay.
for having me. I really appreciate it, and I had a good time. I hope the people watching learned one or two things from Uncle Dan and Ash, and I'll more than happy to join another one.
Yeah. So I shall call you Uncle Dan from now on.
Yeah, sure, no problem.
Okay, sir. Bye bye. Take care,
All right,
please.
see ya. Take care.
Okay. Bye.